Prior to the creation of your invisible braces, a record-taking appointment involving X-rays may be required to assess bone level, the length of the roots, and the position of your teeth. Additional assessments, such as the need for tooth extractions and the relationship between your upper and lower jaw, are also considered. After the assessment, a virtual model of the teeth will be created. This can be done in one of two ways. The first method is to use a special tray and impression material to take an imprint of the teeth and arches. The other and more popular method is to use a digital scanner to create a digital impression of the teeth. The impressions taken are then sent to be virtualized into 3D renderings. Once rendered, the dentist will use the virtual models to create the prescription for the series of custom clear aligners. Upon the arrival of your custom aligners, small and discrete tooth-colored attachments will be bonded to precise locations on specific teeth. These attachments provide anchorage and direct desired forces on certain teeth. In addition, the attachments help to ensure adequate tooth rotation and effective upward or downward repositioning. Each aligner in the series is worn every 2 weeks, creating small and controlled movements that are no more than a fraction of a millimeter. The overall sequence of movements help lead your teeth into its ideal position.